All right, guys. So again, as always, thank you for the opportunity to talk to you today. We're going to dive into our health series, and as we get closer to the time frame of open enrollment, it's always good to know product. It's also good to know how to submit the business. So we'll kind of talk about that today in regards to getting set up with our ACA platform, Messer Financial. So if you have not gotten set up with them yet, feel free to email me at phil@valorfs.com. I will put that in the email or the chat session as well. So we can get you set up with contracting so you're good to go from that standpoint. Today, what we're going to do is kind of dive into the platform. For some of you, this might be a repeat. For some of you, it might be new. But the other thing that I would always say is that if it is something you've already seen, you might actually see something new. So it takes probably about 5 to 6 times before something actually clicks and makes sense. So, we'll talk about that today, some of the resources you have available at your fingertips. So, first off, if you are in the Messer system already, you should be getting, email communications and things like that. So, I got this email earlier today. So, 90 days, dozens of tasks, one agent. So, I pulled it up to see their playbook guide. So, they talked about the rules of the road on April 2nd. Rule was published. And then October 1st, new marketing communications rules for AAP will become effective. So a lot of stuff is coming down the pike. Believe it or not, I mean, we're already almost in August at this point in time, 3 days away. Um, so from that standpoint, we have a lot to do in a little period of time. So getting your scope of appointment, RTS, right to sell, getting your educational material ready to go, so you are not waiting till the last minute. The last thing we want to do is wait till the last minute because this stuff is going to come at you real quick. So from that standpoint, we have a awful lot of information for the ACA side to go through. Um, does everyone else hear me okay? Just want to confirm. Thumbs up if you
Yep.
can. Okay. All right. So we'll dive in now to kind of what I would say is the actual platform. So we'll talk about my MFG and so this is all basic information of me. So hopefully YouTube doesn't have a fit about this, but yes, I am 44, so I'm willing to admit that. So when you get set up with Messer, let me just preface this too. Messer will have the ability to help you from a national scale if you are not in an area that has a basically a state-based exchange. So New Jersey, Virginia, Georgia, Illinois, those are going to be state-based exchanges. So I will show you where to find how to get set up with those as well, so you're not left out in the dust. But what I will tell you too is that from the standpoint and from the conversation here, you never know where and how business will pop up. I had a client call and reach out to me and give me a recommendation to talk to a friend of theirs in Arizona. So Arizona was not a state-based exchange, I don't think, but either way, I was able to get it done through the system. I'm here in Tennessee, but I have customers in Georgia and Illinois as well. So, it's a toss up where the business is. But to have it at your fingertips, to understand that you have it available too, gives you that extra value proposition. Now, this is a proprietary uh, um, system. So, in order to access my MFG, you need to have all your ACA contracts with Messer. Okay. So ACA contracts is different from ancillary. So when Drew and I would talk about, Med Mutual, Allstate, um, Philadelphia, Manhattan, and UH1, those we have through a separate lineup because those are ancillary products. Okay. Those are direct to the carrier versus this, which goes through the Messer platform. Okay. So think of this like an alternative to Health Sherpa. Why is it beneficial? Okay. So first and foremost, when you log in, it does have the authentication with CMS. So you will get set up. You'll have to re-authenticate and log in. I did that already to, skip the lag time of getting an email, waiting for the email, punching that in. But, from this standpoint, I'm able to view my appointment requests, view my RTS report. So what's available, I will, not show that given it would probably get flagged by the YouTubes, but you'll be able to see every carrier in every state that you're available to sell in with your RTS report. And then let's say, for example's sake, as we all know, the time frame is coming for open enrollment. So what you'll see at the top here is a lot of options. So the first option, I can do a quick quote. And inside of the quick quote, you'll see ACA. You also have Medicare Advantage too. So we have both in here. But let's say I want to run a generic quick quote. So I click here and I can pull up based off of my zip code. So we'll just say 37069, which is Williamson County in Tennessee. I'm not going to put email or phone number in. And then what we'll do is we'll just keep it very generic. So I'll just say Mr. Resh. So, and date of birth, 12/22/1981, male, non-tobacco, and we'll leave the rest. Okay. I'll add a spouse. We'll add my loving wife, Mrs. Resh, and date of birth 09/03, 1982. No, and female, and she is not pregnant, thank God. And so now we have our household here. I'm gonna nix the kids for sake of time, but what this is, first and foremost, this is a calculation for subsidy. Okay. For those who don't know subsidy, just the general idea of subsidy is the opportunity where if someone is below the federal poverty level, they have the ability to get some extra cash from Uncle Sam to help cheapen the cost. Now, in the past, what people would do, the present company included, would say I make no more than 30,000 a year. Why do I do that? Because it puts more money in my pocket throughout the year that I can use, I can spend, I can get some tax deductions, whatever. But then typically what happens is I'll get a 1095-A at the end and it'll say, hey, Phil, you used, let's say, $18,000 worth of subsidy. Well, based on your taxes, you owe us $18,000 and then you pay it at tax time. So with the new Big Beautiful Bill Act, basically they stripped all of that. So now you have to, disclose what type of income you have. Typically, these companies are not stupid either. I did have a Blue Cross Blue Shield of Tennessee, and it went from, let's say, $1,900 a month to $3,500 a month. So they saw my tax returns are like, no subsidy for you, close the book on that. And so, I went shopping for a different route. But here you can basically calculate subsidy for people. So you put their information in, it's a two-person household, and let's just say the annual income is $45,000. Okay. So if I hit calculate subsidy, it will tell me I have the potential of getting some type of government assistance based on what I put in here. Okay. Once again, they're getting very finicky when it comes to just throwing in numbers and information. Because of that, just watch out. This is a protection more for you. The client has to do what the client's going to do, and they could get in trouble for it. but I don't want you to lose a license because you're trying to find, $0 coverage for the customer. And next thing you know, at tax time, you're going to see like 40 of some clients, for the same agent, all have the same issue. The government can track stuff like that. So as you can see here, if I move forward, I have a type of subsidy. But if, for example's sake, we were a six-figure household and we recalculated the subsidy, now you'll see I've got nothing. Okay, so absolutely nothing. We make too much to get any type of tax credit or subsidy for myself and my wife in this scenario, and because we are too far away from the federal poverty level. Does this make sense so far? Does anyone have any questions? Thumbs up if you guys are good. Thumbs up. Okay. So let's say, for example's sake, I'm in this situation, we make about 100K. I'm going to hit view plans. And so very similar to what you see with like a health Sherpa, things like that. You have all the information here from the different carriers. Okay. So Oscar, UnitedHealthcare, Ambetter, Tennessee, Blue Cross Blue Shield of Tennessee. And again, I didn't put my kids in here, so that's why it's cheaper. But nonetheless, you'll see a lot of options. So if you want to digest or look at these, you can do up to three on the same comparison. So if I wanted to look at, say, Oscar from the bronze standpoint, and then maybe I wanted the Blue Cross Blue Shield of Tennessee, and then I'll click on filter plans, and let's say I want to take out the bronze and the gold and just look at silver, and I'll take a look at some of the quotes here, and we've got Oscar for that too. So I'm going to click on this one and hit compare plans. So here you'll see that we have them all together. So 1176, 1617, 1254. So you have three different options. It gives you all of the out-of-pocket maximums. It gives you the deductibles. It gives you all the information that you need, some ratings. I don't know where they get the star ratings from, to be honest, but you have your wellness care, $0. You'll see no charge after deductible for this plan. Only $40 for a primary care visit outside of your well care. Specialist visits, so 40% or $80 or no charge once again after deductible. So you can see some of the differences here, depending on which plan you want to go with, to allow your clients some options to review. And if you're doing this with them, you can click on plan benefits. You can do more of a deep dive from this standpoint and show some of the more interesting information to kind of go down the rabbit hole. What I would say too is, as a cheap, shameless plug, as I've mentioned before, we do have the docs to video. So if you took these 7 pages and you wanted to simplify it for someone who doesn't want to read all of this, upload it to docs to video and send a 2-minute explainer to the customer about all the benefits that you can get in this. So again, it's not just for life insurance. You can use it from the health standpoint as well to help explain some of these things in a simpler manner. And again, for those who saw the presentation on it, we're in the final process of getting additional languages to simplify the process for those who do not speak just English. So if you want to send these to a client, what you can do is click on print and you can save it as a PDF. It'll give you all the information here to pass along to the client for the basic information. We don't want to give them everything. I'll take my email address, phone number, whatever, so they can call me, but we don't want to have them just accessing healthcare.gov and things like that to just, move the plan forward without us. So you can do this. I would say here's a little way that you can, send it off to the customer, save it as a PDF. Or once again, like I said, if you want to do something that's a little snazzier, something that they can watch, do the docs to video, and you get it kind of in their face, so you have someone else explain it, and then you come in behind and finish it up. So options there gives you, kind of an outlay for everything. Now, if I wanted to, on the same token with the quick quote, if I wanted to send the link to a customer, I could simply do that as well. And it will go like this. And what you'll see is like I'm the nerd who, looks at how the links look. So you can actually see the referral code right there. So agent ID PRESH. So it gets appropriated to me. And so therefore I can send this to my clients, have them fill it out at their will based on the information, same stuff that I put in on that last page, and I'll just say, Mr. Client and 12/22/1981, male, male, no tobacco. And I'll just do single person by myself. Affordable care, no, nope. So hit next, give my information, and that's your data collection, right? So we'll put the information in, annual household income. We'll just say 50,000. And then let's see, oops, household size, one, and then 40, let's just say 50,000. So calculate savings. Hey, I got a subsidy, view plans. Now all of a sudden I can have my clients look and they can apply right away, and it'll go towards your credit as well. Because once again, you see PRESH is still in here. So if you want to take the simple route, here's a quick and easy way to do it. As some people have suggested before, you can take that link that I just put in there, scan it to a QR code. So if you do events and you want people to, put their information in, this will now become tagged. You'll see all my information is up here as well, but it'll be tagged in my client list that I can generate and build. So it's a simplified process to help you get through to more clients quickly. Some will just do it by themselves. Some will want your assistance, but it's an opportunity for you to get some easy and quicker sales. EDE search is on the flip side. If I want to pull in my information from yesteryear with the coverage, so say 25, and we'll go to Tennessee. Um, you know, so I've gotten permission from myself, and it'll pull up old applications and things like that. So you have the opportunity to get all your information in here from healthcare.gov. You can also add the information in to your client list, and we'll just say Resh. We'll click on this, and as you can see, I have my whole family in here. I'm doing it quick for reference sake, but nonetheless, you have the ability to build out your data list here. If you have a bunch of clients in, let's say, Health Sherpa, and you want to upload them to this system, you have the ability to do that in the client section. You just add the upload feature, and it allows you to pull in your data from other sources, to say the least. And so this will help you again with your right to sell. You can see exactly where, who, and what states you have them in. So if you are like for me, I'm in Tennessee, but if I want to prospect like the Arizona case that I did, I had Oscar. I have Arizona as a license, but I don't have Oscar in Arizona. So I did write the case, but I got no commission for it. So you want to make sure you have the locations and everything available so you can sell it and actually, make some money. Okay. So this is my MFG. Again, to have this tool at your fingertips, again, you can do this for not only your ACA business, you can also do it for your Medicare Advantage business. So it's not just ACA only. We'll take a dive into the Messer platform, the Agent Control Center. But want to ask again, I'll just double back. Does anybody have any questions about this?
Well, I have a question.
What's up?
So EDE person search, do we have to sign the consent like in Health Sherpa, there's a consent form Is the messer provide that consent form, or do we have to upload it where they keep the record for 10 years, or how it's going to work out?
Yeah, so they have the consent inside the Messer platform. You can either do it by email or you can do it by text message, and
Hmm.
it will control the consent from that standpoint.
Okay. My other question is, how is the state-based works?
We'll get into that in just a minute. Okay.
Okay.
Yep. So
I
you
have a quick,
can't really, what's that, Michelle?
quick question. So sorry. How
Yeah,
did
you're
you
fine.
how'd you get your the link again? Like that you would send to your client? How did you snag that?
Yep. Under quick quote,
Okay.
send link to my client, and
Okay.
it's right there.
Perfect. Thank you.
Oh, no problem. So, or you can send it to them. So you can send it to the client. Okay. So different ways, different strokes for different folks. Great question though. So let's dive over into the agency control center. So they've actually updated the agent center. So if you didn't see it, let me know. They sent a password request to change. So so it's on, I guess, WordPress, but I'm gonna log in here, dive on in. And so it looks a little less clunky than what the prior one was. So they've added a few features to it. So first and foremost, your calendar is right up front, so you can see what type of events are coming up. I would probably recommend clicking on the event calendar so you can see. Now, keep in mind that they do have, like typically what you'll find for a lot of health agents is they'll do health and they'll do like final expense or term insurance or stuff like that. So you'll see a lot of the like Americos, and different things that they have from a training perspective. Respective again, they have a Manhattan Life training, but we have our Manhattan Life contracts elsewhere. Doesn't mean you can't join these and just listen in. And no offense, Drew, I know you're on and you do a great job, but there's extra trainings for everybody. um, so yes, you can dive into more trainings, special enrollment periods, things like that, how to elevate your insurance business. So they have a bunch of different trainings here, and I'm sure more and more will ramp up as we get closer to the open enrollment timeframe. So that's again on the main page as soon as you get into the agent control center or agent center. This should be step two after you go through the SureLC contracting. If you need to get more contracts, you can do it directly through after you get set up initially. So let me know if you need that. Then moving up here, so these links aren't quite working yet, but if I go up to the ACA under general information and I click on that, you'll have all the FFM certifications here. So I hate that it keeps going down there, but again, nitpicky stuff. Returning agents, so you could log in here to go to CMS and get your training done when it is up and ready. If you're new, they have all the instructions here on how to get set up. So the CMS Enterprise Portal, you want to get your training done and everything here. So it's a step-by-step instructions to help you get to where you need to be. Um, Now going back here, if I go to, again, these hot links don't seem to work sometimes, so I would just rather go up here to state exchange information. So Z is your question right there. How do we access the state-based exchanges and what's the benefit or what is the information, in regards to it? So every state-based exchange is here. So, the question always comes up, why the hell are there other exchanges when you could all do it in one place? Easy. The government gives the states money when they do state-based exchanges, so they get a little cream off the top, as opposed to the government getting the money for their top level, whatever. So every state wants to get a little extra money. So you're seeing a lot of state-based exchanges. So for example's sake, and I don't know why these aren't in alphabetical order. So if I hit Illinois, click here, Illinois got an error. So way to go, Z's. Your state is weird. um, so if I go back, let's try New Jersey. So click
Georgia.
here. Yeah, I'll do Georgia next. So yeah, brokers and agents, you have to fill out some information. So you get a right to sell inside of there. Typically, you have to run through a test to get appointed in those state-based exchanges. I had a, potential customer in Connecticut that I can't actually sell to because, I'd have to get covered with Yukon Health or whatever. So there's a couple finicky things with the state-based exchanges. Some hoops you have to jump through, but each one will have their own separate deal that you'll have to kind of abide by. And I did Georgia a couple years ago, so some of these, there you go. So log in, create an account. You can get technical assistance there. So sign in. I did it a while ago, so if I jump back in, I could probably get it again. I just don't feel like getting it again. Um, so you'll have all the information for the different state-based exchanges here. Again, they can't be tracked inside of the MyMFG because of the fact that they're monitored under a different location. Now, this is what I would highly recommend for any ACA plans that you have. I would keep a separate spreadsheet, whether you do it through MyMFG or if you're on a state-based exchange. I'd recommend having a spreadsheet, name of the client, policy number, carrier, because when there's sometimes the big perk on partnering with Messer is they will bulldog the carrier when it comes to reconciliation of commissions. So if you feel like you've been shafted by UHC, Ambetter, or whatever, here's a list of your cases, and then they'll go and bulldog it with the carrier to say where the heck is the money, why hasn't the money been paid, and go from that end. So using the biggest or one of the biggest FMOs in the country, that's one of the advantages of partnering with them from that standpoint is commission reconciliation. But they do again ask for you to keep a spreadsheet of your clients. So wherever you plan on housing that, if you do state-based exchanges, I would just recommend again having it separately because some state-based exchanges, I don't really know how they have them set up. So I don't want to guide you in the wrong direction for that. On our end with Health Sherpa or MyMFG, that's obviously a list that you can maintain and manage. But that's why I say having some places as well for like an Excel sheet might not hurt to have. So, um, so Aziz, does that answer your question in regards to the state-based exchange?
Yes, but what my question is that if you're asking to keep a separate Excel sheet and all that too, is Messer has their own in that MFG a CRM system or something that we can just get the information from those lists instead of making another Excel sheet? Because if I'm talking 37 states, it's a hell of a work.
Oh yeah. I mean, so that's why I say like state-based exchanges, they're not going to be in MyMFG. Right? You might have a client list that you could put in there, but you might have to shop it into the state-based exchanges. So that's why I say, depending on certain locations,
Mm-hmm.
it never hurts to have a master sheet. But
Mm-hmm.
that's just something that I would say is more or less a matter of preference. So I like to just make sure I have it somewhere else. You could probably pull it, from a dedicated list. The only reason why I'm not showing you it is because there is other data in there that I don't want to
Yeah.
show on this. But,
Mm-hmm.
nonetheless, yes, you can pull a client list from there. respectively too. So those who have the use for it will have the ability to pull it up from there too.
And okay, so we're not going to talk about Medicare at this point, but okay, sounds good.
Okay, cool. Going back to general information, so it'll go down like it, yep. So here's where if you look by states, so you'll see the carriers that we have for the respective states. So like Texas, you got Georgia, you got Florida. So for example's sake, for Florida, so Michelle, I'm staring at you. These would be the carriers you want to go into your Sure LC and get contracts for, so that when the time rolls around, you don't miss out on the opportunity to sell said business. Um, and so that's where I would say being proactive today, getting it ready today, as opposed to waiting, 2 months from now and saying, "Oh, I don't have it," because there's blackout dates. Carriers will completely knock you out because they're too busy processing business. So we want to make sure that we get it done sooner than later. And if you want to set up a strategic conversation, getting these set up, if you've never done it before, feel free to get in touch with me, email, text, call, whatever, and we'll book a time because I want to make sure you guys are ready, to sell. Any questions at all? We have a team. So myself, yeah, Drew and Joe and Gloria all here to help out as well, because we want to make sure that you guys are ready for the season and really crush it. So um, this would be the spot where you could see all the additional resources, all the additional states, what type of carriers we have here. And sometimes what you'll see is, so like, there's slim pickings for some states. Like I've got what, five? And, from that standpoint, let's say there's some Joe Schmo insurance company that has like half the cost of all these other guys. That's just tearing through ACA in Tennessee. Um, Typically, you won't see that with Messer, because they're only going to work with the carriers that have been around for a bit, that have that last stability compared to some carriers that just want to, I don't want to say a quick buck, but just they're in and then they're out just as quick. So you'll see more of the major carriers here. You don't even see Aetna in Tennessee. Aetna is on their way out. So, when looking at that, we're looking at some of the major carriers, uh, as opposed to the smaller carriers in the local areas. If you do have one in a local area, I'll give you the quick horror story. Baylor Scott and White. So they were. I was fighting for about 2 years to get them into the system because they were so big in Texas. Matter of fact, that Messer actually had to get an office domiciled in Texas to be allowed to have the contract for Baylor Scott and White. And then just this year, they're like, "Hey, we got it." And so we started contracting a few people, and then they're like, "Oh yeah, we're not paying commission on it anymore, and we're probably going to get out of the market." So that's why I say some carriers that are in local areas might make a big splash and then exit just as quickly. So a lot of times I'll say, do you want to have that awkward conversation of you need to open up a special enrollment because the carrier doesn't want to do it anymore, or do you want to stick with some of the bigger names and some of the bigger opportunities, comparatively speaking? So if you have a local carrier that you want us to take a look at, I always say you miss 100% of the shots you don't take. So feel free to send them over, and I'll gladly see what we can do. But on the same token, just kind of understand what you have at your fingertips and how you can use those. We also have a problem getting appointments with Blue Cross Blue Shield of Alabama. Let's see. Well, yeah, I was gonna say all we have is Ambetter and UHC for Alabama. So Netra, if you want, just email me and I'll see if there's something that we can do. So like I said, if I can fight for it and we can get it, great. If not, what they're saying here is what we got, Ambetter and UHC. So if they're close from a cost perspective, see how you can put lipstick on the pig. But if not, I completely respect that, and I'll gladly fight on behalf of everybody here to see if we can get those local carriers. But just email them to me so I can take them and see what we can do. No promises, but I'll try my best. Any questions on this?
Are we able to start the FFM certification at this point, or do we have to wait?
We still have to wait. It's not ready yet.
Mhm.
I keep checking. So for some reason, like when I go in, the only
Mhm.
thing that I have available is like is actually I accidentally messed up one time, and I clicked on the Spanish version, and it was like, so it's still lingering in my inbox from like 2024. And so I'm like, I wish I could just get rid of that. But let me see if it has popped up.
So I'm doing
O2.
recertification for the other companies too, and the only thing is missing is FFM.
Yeah, I forget the exact date on when it's available. Um, it's my portal training. Was everyone just taking a break today? This is ridiculous. Um, I
Mhm.
don't know. Well, I guess I can't give you that answer right now, buddy.
Okay.
But yeah, what I'll do, what I would say is you know, it is coming. So let's see. Did you hear any new updates or rules or exclusions for ACA markets? That's on my to-do list, Netra, so I'll have more insight on that. I'm gonna do a couple quick searches later on and put in the newsletter for next week. So if we have any updates from that standpoint, it'll go in the newsletter. All the more reason for everyone to check their emails. Don't forget, I can see who opens them or who even clicks on them. It's hurtful, hurtful. But anyway, that's a different story for a different day. I'm staring at you, Aziz. I'm staring at you just because. Um, so anyway, um, any last questions? Anything I'm missing? Helpful? All right. So I'll put this up on the YouTube later. Hopefully they won't block it, because I put my name in there. But nonetheless, if you guys do have any questions, again, time is of the essence. We have a short period or window before all of it starts. So appreciate you guys. Let's have a great open enrollment season, and we'll talk soon. So have a great rest of your day. Thursday, for those with us on the live side, we got our trainings as well. So we'll talk soon. All right. See you.